It's 6:21. Keep that bottle of sunscreen handy today because the sun is going to shine and things are going to get pretty hot. But what if your skin gets too hot, too much sun? Dr. Ronald Downs joins us this morning to tell us how to treat a sunburn. It could happen today. Good morning, Dr. Downs.
Good morning.
And let's start with some of those signs of a sunburn.
Well, you know, sunburns can really range anywhere from very mild to severe cases. The mild ones really manifesting its skin redness and irritation, and they can be very painful. And then you can get the more severe cases, which are blistering and severe pain. And then the worst cases where you get a lot of blistering, fluid loss, electrolyte imbalances, infection, and even shock. And those are the things we call sun poisoning.
Yeah, and some people, you know, they get that and
Yes.
they don't even realize it's happening.
That's right. Luckily, it's very rare. And most of us will have symptoms like fever, nausea, chills, flu-like symptoms with some fine blistering, and you probably peel in about 4 to 6 days.
And that's what we're seeing right there on the screen right now, sunburn blisters, just some mild irritation there, it looks like, on the skin. So if we get a sunburn and we're suffering from some of these symptoms, what should you do? Some people say, oh, I just got to let it go, but you say there's some things you can do at home.
Well, there certainly
really
are.
Help.
You don't have to suffer. And of course, if you have any of these severe cases, you really want to call your physician at home. And you know, there are some things that sometimes he might even suggest you go to the emergency room. For instance, if you're really excessive pain and blistering and you're fainting or nausea at home or confusion, he might send you there. But there are some more common things we can do around the house. Things such as medications. We all have aspirin around the house, and that family of medications, anti-inflammatories, are very helpful. Ibuprofen. Cool compresses are very, very important. They will help soothe the skin. And interestingly enough, we can use a half mixture of milk and water at home.
Milk and water.
Milk is a great anti-inflammatory, very soothing to the skin. And also very inexpensively, at any pharmacy, you can buy Burroughs solution, which is an aluminum acetate solution. Very soothing to the skin, good anti-inflammatory effect.
Okay, again, that's Burroughs?
Burroughs, B-U-R-O-W.
Okay, that's good to know. Also, a cool bath, you say? That would be a good thing, too.
Cool baths would be great, not ice-cold baths. Now, remember, the skin is the largest organ on our body, and if we damage it with a sunburn, its temperature regulation ability is very limited. So if you get an ice-cold bath, you're actually lowering your body temperature, which can make more damage occur. Aloe is something a lot of us have around the house. Some of us even have aloe plants.
Yeah, I do.
Break off a leaf and put the gel on your skin, and that's very, very helpful. And again, you want to avoid things like rubbing or shaving that area. I mean, that seems like common sense stuff. But
and the perfumed lotions and things like that.
You want to avoid any moisturizers are great for your skin, but you want to avoid anything with perfumes or scents. Your skin, again, is damaged and hypersensitive, even in those cool baths. You want to avoid any bath salts or bath oils that might be harmful.
And those anesthetic lotions, they might be trouble too.
Well, there are anesthetic lotions that we all find out there that can contain compounds like benzocaine or any topical anesthetics. Again, your skin is very sensitized to those things, and you don't want to use them because it'll make your symptoms worse.
Okay, real quickly, Carol wrote us with an email question. Let's get to that now.
Sure.
It's really interesting. Is it true that sunburns cause the damage that leads to cancer, but if you tan without burning, are you not at an increased risk of cancer? This is something a lot of people have in mind. That's why they go to tanners before they go on their trip to Mexico or whatever. What do you say?
Absolutely no. Your risk for skin cancer is directly proportional to the amount of UVB radiation that you're absorbing in your skin. A sunburn only means that you've had too much at one sitting, but it's the overall accumulation of that radiation that makes you have that susceptibility to skin cancer.
So tan skin is damaged skin.
Yes, it is.
Boy, that's something to keep in mind.
But most importantly, you know, over time, with all that radiation damage to your skin, it's going to damage the collagen layer, and it's going to cause those wrinkles that occur in your skin, and actually can give you a really leathery appearance to your skin. And again, you can get those ugly brown lesions called keratoses and ultimately skin cancer.
Age spots, well, basically.
We can call them age spots, but it's sun-damaged skin.
Yeah, absolutely. Well, Dr. Downs will be back to talk about transitioning your makeup and skincare routines to get ready for summer. Thank you so much for being here, Dr. Downs.
It's a pleasure to be here.
We'll be back with more after this, and you can always drop us your ideas for our special health and beauty breakdown segment.